Okay, now we are going to talk about pressure. So here is my screen. I'm going to make this bigger. So this is two handouts. All of this is super relevant after we just talked about the demand findings of that Shaw et al. Article and findings. So when someone comes to see me, I usually find out they are holding their breath. I would have to say that 90% of the people that come to see me, they could either fix themselves or they have pressure management issues, and that's why they need to see a pelvic floor physical therapist um, in the first place. So, pressure management. I made this handout. This is all the things that I talk about all the time and like constantly hope that I always tell people that I'm hoping I'm little Jiminy Cricket Stacy sitting on your shoulder, reminding you to pay attention to when you feel pressure and when you're holding your breath. You may feel that pressure at your lower abdomen, or you may feel that pressure in your pelvic floor. So have appropriate expectations when increasing the demand at your pelvic floor. So if you are having a full bladder and then you're carrying all of those groceries, like that example that I always use, then remember that you have just challenged your pelvic floor to the brink of its issues, of its strength, of its availability, of it coming to the party. And then if you're going to have some issues, of course you're going to have issues right then. So remember the demand graph and and meet your pelvic floor where it is. Right now, it may be that is too difficult to unload groceries and have a full bladder and carry the baby in, or eventually you'll be able to have a full bladder and go for a run and you can run 3 miles but not four. Like it's the same concept, just challenging your system according to what you can handle. So most people are holding their breath during the transitional movements. So getting out of the car, I want you to bend over nose over toes when sitting down, or getting up from the chair or the toilet. I want you hinging at your waist. So that's why I always see orthopedically, how are they moving? Like, are they squishing all their organs out, or are they moving and bending their body to keep a long torso so they're not shoving all that pee out of them or moving all their organs down? So whenever you get in and out of bed, make sure you log roll in and out. When I remind everyone at this time that whenever someone has a spinal surgery, this is whenever they are supposed to learn beforehand, and I teach high schoolers that that's how you're supposed to log roll out of the bed. It is the best way to protect your spine. You only get one your whole life. So make sure you exhale to decrease the demand at the abdomen and pelvic floor. A lot of people after they've had abdominal surgery or back surgery, they have to hold a pillow across their chest, across their abdomen when they're doing this to cough, laugh, sneeze, and it's so that way you're protecting yourself. Whenever you're lifting anything, even a diaper or a Kleenex from the floor, make sure that you are not holding your breath. And then fully exhale on the hard part of the exercise. So whenever you're bending down, you're breathing in, or you're breathing out to pick up that Kleenex, you're breathing out, whoo, and you are lifting from the bottom of you, from the bowels of you. I like to make some of the same jokes every time because they're so good. So when toileting, do not ever blow your nose on the toilet. I'd have to say that 90% of the people that see me, they are too busy to blow their nose throughout the day. They have a seat, they say, oh, great, there's toilet paper right here. And then they blow their nose whenever they're in this very vulnerable position. It will push pee out of you, it will push poop out of you. It is a good way to better empty, but it makes a bad habit for whenever you sit down and you did not want to be pushing pee and poop out of you, and then all of a sudden your body, or and then you grab the Kleenex to blow your nose, and your body goes, oh, every time we do this we push and bear down and let everything come out of us. So do not push your pee out. Pee should just come in a steady stream. If it is not pee, if the pee is not coming out, you can apply pressure at your abdomen, lean side to side, stand up. I put toilet paper down, stand up, sit back down, and then allow for more urine to come out. For this one, this third bullet, I remind people who are very orthopedically asymmetrical that if they have a painful hip or painful foot or knee, that usually the pelvic floor on this side is just more atrophied, is just smaller than the other side. And so picture your bladder being like this, because there's just less bulk over here. So then you try to pee and this side empties, but this side is like just slow coming. So that's why you kind of use gravity to help all that out of you. So you can apply pressure at your belly just to lift and kind of push the bladder back on top of the urethra, but you don't want to be bearing down. So I like using Squatty Potty, a trash can. I had someone recently tell me that they actually put 2 rolls of toilet paper underneath their feet. They just grab 2 toilet paper rolls, stick that underneath their feet. It elevates their feet to allow their pelvic floor to fully relax. This muscle, the puborectalis, it actually lassos from the pubic bone all the way around the rectum, and it squeezes at the urethra as well. And whenever your hips are up by your ears in that squatting position that we were made to pee and poop in, then all of that gets longer and then everything is able to empty better. So I don't really care if people spend the $40 on the Squatty Potty. I do like that the Squatty Potty does tuck underneath the toilet really well, and that it has a hole for like your feet for males to like get really close to the toilet. That way they're not standing really far away and aiming. I like a clean toilet seat to sit on. And remember that everyone should be sitting, no squatting over the toilet. Let's let your body chill out and relax fully. Consider humming like a monk or a child, or in Lamaze class. I like to remind people that little kids in like a public toilet, public restroom, and if they're going to the bathroom, they're like them making that noise is their body's way. They know how to empty this thing. Or a little baby, and you're like, oh, I know what you're working on. Do those noises. You don't have to hold back. You're in the restroom. You're finally in a place that's safe for you to go to the restroom. Let's go to the restroom so we only have to do it one time. It also, this noises and everything you're doing here is also increasing the vagus stimulation to open up your vocal cords and your glottis, your highest diaphragms. We have 3 different diaphragms. So, vocal diaphragm, breathing diaphragm, pelvic diaphragm, to allow your pelvic floor to relax fully. Be efficient at pooping. You do not want to be hanging out there. So if it's been 5 minutes and you do not think that you are empty, you need to do some of these things before that 5-minute mark and get out of there. You're going to give yourself hemorrhoids. So then I have a whole splinting handout. That's actually the bottom of this. Actually, I guess it's the next video. It's the splinting handout. So we'll go over that. And then when you think you're completely empty, you can bear everything down, and then you can be wiping with toilet paper or a wipe, but then you're gently going to push everything back up and in after each restroom use from the outside of your body, or even with the toilet paper or the wipe. So bearing down, letting everything come out of you, and then you're politely tucking things in the rectum. Anytime if the bladder is coming a little bit lower, you can just politely press on the outside of the labia or at the perineum. You're just going to let everything hold back up. So you want all your organs to stay where they're supposed to, and not kind of things that hanging out too low is where they're supposed to be. So when you're about to cough, laugh, or sneeze, you can pull the air as low as it can go. So basement breathing. So you want to breathe into the basement, so letting your pelvic floor absorb that air, but then you do not want to be blowing out the windows whenever you breathe in. And then you can breathe out. Oh. So it cannot go any lower when you increase pressure. So picture you taking a shallow breath right here. And then whenever you breathe, the air can't go any higher. So then it goes lower. And that's when people are coughing, laughing, sneezing, and having incidents. But if you're absorbing that air to the bottom of you, then that air can't go any lower when you cough, laugh, sneeze. It is there. Then it has to go up. What goes down must come up. So squeeze your shoulder blades together, have a slight anterior tilt of your pelvis, stick out your booty. If you're laying on your back and you're trying to cough, laugh, or sneeze, maybe roll quickly on your side so you can activate all these muscles. And remember, using the balloon to blow up best to prepare for coughing, laughing, and sneezing before intimacy. So I usually, probably like the 3rd or the 4th visit, I have them blow up a balloon, and then they're using your air to blow the balloon up from the bottom of them. So, and I use the balloon to simulate coughing, laughing, or sneezing, but it's really hard. And it's really hard to make someone cough and laugh and sneeze. So blowing up the balloon is a really good pressure management technique. Then I remind everyone that sometimes people just have to have a prolapse surgery. And I am so sorry. Like some people are just ligaments is lax, their myofascia is just heavy. But if they have to have it a second time, so they did it studies and they found out that some people just have to have them. And there wasn't really a reason, like a good reason why these people had to have their organs lifted the first time. But if they had to have it the second time, they had a higher incidence of a rounded thoracic spine. Excuse me. Excuse me. Or they had scoliosis. So their body was already kind of pressing some organs down, or they were rounded and they just don't have enough room for their organs. They had increased weight. For every 10 pounds of weight that they were carrying, added a higher incidence of needing that surgery a second time. And if they had any coughing diagnosis, could you remember that demand graph? Boom, boom, boom. That is how hard their whole life is on their pelvic floor. So I give that to people whenever I find out that they are not breathing, which usually on the first day I find out that they're not